Thank you.
Oh, my pleasure.
Good morning, everyone. This is Cassie Sauer at the Hospital Association, and we are going through and granting you all recording privileges. So it will take us a minute or two, and then we'll get started. Thanks for joining us.
Recording in progress.
Good morning, folks who are just joining us now. We're going through and giving everybody recording privileges, which takes us a minute or two, and then we'll get started. Thank you for joining us.
And we're good on my end.
Great. Thanks, Ryan.
Mm-hmm.
All right. Good morning, everyone. Thank you so much for joining us for our media briefing. I'm Cassie Sauer, and I'm the CEO of the Washington State Hospital Association. I want to first start by saying that we are very disappointed to be back with you. I think the last media briefing we had was 4 or 5 weeks ago, at which time we said we were going to pause and maybe cancel these because we felt like there was not enough COVID news. And that is no longer the case. There is plenty of COVID news to share today. So we wish there were not. We are sorry to be here talking to you about it. And we do have some great people here joining us today with some very good statewide knowledge about what's happening with COVID. So we have Dr. John Lynch, who is the Medical Director for Infection Control at Harborview. We have Florence Chen, who is the Executive Vice President and Chief Operating Officer of Multicare Health System. Multicare operates in both the Puget Sound and the Spokane regions. Florence also serves as the chair of the Joint Washington and Oregon Hospital Association Safety and Quality Committee. So has been very instrumental in our collective COVID response. And finally, Dr. Nathan Schlicker, who is an ER physician, also in the Puget Sound area, and currently serving as the board president of the Washington State Medical Association, is here representing the Medical Association, who we've worked in very tight partnership with throughout the pandemic. So thank you all for joining us. And I'm going to start with some opening comments, hand it over to the panelists for some opening comments, and then we'll take your questions. Either you can ask them, you can verbally, or you can put them in the chat. So we are back with you all because there is a lot of COVID news to share. The most concerning is, of course, the Delta variant, which is rising really rapidly in our state. It appears to be very contagious and be making people very sick. The state is pulling together data looking at the number of, first of all, people who are diagnosed with COVID, but secondly, those who are in the hospital with COVID right now, how many of them are vaccinated? We're eagerly awaiting that data, but in the meantime, a number of our hospitals have queried the state's immunization information system against the COVID patients they have, especially those who are in the ICU or are very, very sick, and are finding that 0 to almost 0 of them have been vaccinated. So we are caring for even though there are people who are vaccinated who are getting the Delta variant, they're not getting sick, and those who are getting sick are not vaccinated. I want to say that it is very demoralizing for the staff in the intensive care units and critical care units who are having to care for the very sick COVID patients to do so. It is scary and emotionally draining and very physically exhausting work to care for COVID patients. And to feel like, or not to feel like, to know that this is a preventable disease at this point, that people can take an easy action to protect themselves from getting this sick is really challenging. And their families are not able to see them because they're on COVID isolation. And when there are deaths, I think we've mentioned this before, the community response is different now. There's a number of patient families have said to our caregivers, this is really hard because people are saying to me, like, why'd you get COVID now? And they're not getting the sympathy and the response that they would like from their families and friends. So it's all around a very, very challenging situation. I think really underscores the need for vaccination. And I've said this before, people have said many times to us, what can I do to support my frontline healthcare workers? I want to bring them cookies. I want to bring them pizza. And what we keep saying is don't get COVID. That's the best way to support them. So at this point, get vaccinated so you don't get COVID. It will put their heart and soul into caring for you, but they would very much rather you stay healthy. So I think that's a really important message. Also, we would encourage people to continue wearing masks. We mentioned in a recent media briefing that I and everyone we've had on the panels still wore our masks throughout. I never stopped wearing my mask at the grocery store. And one of the reporters said, "Aren't you worried people are going to think you're not vaccinated?" And I said, "I don't care. I want to not get COVID. I don't want to spread COVID. I've got a kid at home who's not eligible. He's too young. I don't want to bring it home. I don't want to give it to my coworkers. I don't care what people think if I'm wearing a mask." And I really encourage people to wear a mask. I also would like to mention that hospital capacity right now is very tight. You all have probably heard this throughout the state. During the pandemic, we experienced certain regions of the state got very tight. At the beginning, it was in Kirkland and Bellevue with the outbreak at Life Care Center. There were, in the summer, because of the agricultural outbreaks, there was a lot of strain in Central Washington. So it's kind of rotated around the state. But right now, it's pretty universal that every hospital is quite full. So it's a combination of factors. It's COVID, of course. It's the trauma season. So people are falling off ladders and having bike accidents and not wearing their, drowning incidents and gun violence. And so I think for people to be exceptionally careful, to not climb a ladder, you shouldn't. Make sure you're wearing your life jacket and your bike helmet. Be careful and take good care of yourself. It's also the heat. We're worried about smoke. And then finally, it's delayed care. People delayed their care either voluntarily or because of the requirements that hospitals cancel non-urgent procedures. And so there is a backlog of care and people are sicker. So that does mean the hospitals are quite full. There are also patients who need to be discharged and go to long-term care, to a nursing home, to adult family home, a psychiatric hospital, for example, and we're working with the state on moving those patients out faster. A message to the public is if for folks who have a chronic condition or an emergent condition, make sure they're seeing their primary care physician or their specialist to make sure it's controlled so that they can stay healthy and stay out of the hospital. And again, don't get COVID. That's a really big thing we want people to not do. And then my last comment I want to share is that the Washington State Hospital Association Board of Directors last year took a really significant board action after extensive deliberation. And that action is they passed a resolution urging all hospitals in Washington State to require vaccines for their healthcare workers. And it is important because we want to stop the spread of COVID. And we want there not to be spread to our workers within our hospitals. And so hospitals across the state are now considering this urging from the Washington State Hospital Association Board of Directors. Some have already implemented. We'll hear from Dr. Lynch about their work. There's other hospitals that have already implemented. Others are in the process of doing so right now. And then other healthcare organizations are taking similar action, including the Medical Association. So Dr. Slicker is here to discuss that, but there's others as well, including some long-term care associations, other groups that represent healthcare workers. So this is a big deal. We understand that vaccine requirements are controversial, but we think it is the right thing to do, and we are eager to help our hospitals across the state implement this policy. So with that, I will turn it over to Dr. Lynch for some opening comments, please. Thanks, Dr. Lynch.
Yeah, thanks, Cassie. My name is John Lynch. I'm an infectious diseases doctor. I'm based at Harborview Medical Center. I'm part of UW Medicine. I've been working on COVID-19 response and the care of patients since January of 2020. So it's been a long road for me and for all of us on this call. As Cassie mentioned, we were hopeful that we weren't have to be on another call like this, but I see this happening today, and I see a few more coming in the future as we deal with what's happening. We're in a very different place now than we were, even a few months ago, and certainly different than a year ago. When we think about what we're doing in society, the level of openness, the level of interactivity that's going on in our society, both in public and private settings, has definitely changed since we think back a year. Some of these are great developments, but some of them are actually created a lot of risk, where we see folks who are vaccinated and some folks who are unvaccinated together, often without using things like distancing, great ventilation, and especially masks, as Cassie mentioned. The great tools we have now is vaccination. As Cassie mentioned, 99% of people who end up in the hospital with COVID-19 are not vaccinated. Either they don't have access to vaccine, right, because of underlying medical conditions, it doesn't work in them, or they're too young, or they've made the choice not to get vaccinated, or they just don't have access in terms of discussions and questions being answered. The other part of this, obviously, is the Delta variant, which, as Cassie mentioned, is a new variant of concern that is now the vast majority of all infections in the United States and in Washington state. This particular variant, due to different mutations that we don't completely understand, is way more transmissible than even the Alpha variant, the B.1.1.7 we talked about before, at least 2 to 4 times as transmissible. And people with this variant in their respiratory tract, their nose and their mouth, have about 1,000-fold, not 1,000 more, but 1,000-fold more virus up there, which is certainly part of the risk for transmission. The important thing is that the vaccines we have, the J&J, the Pfizer, and the Moderna products we have, are highly effective against all the variants that are going circulating around now, including the Delta variant. The last thing I just want to emphasize before I talk about our response to this UW Medicine is what Cassie mentioned about the hospitals being extremely full. All of our facilities in Washington state are very full for all the reasons that Cassie mentioned. And so we've got a topped off system with workers who have been dealing with COVID-19 response for over a year and a half and are really feeling the stress of dealing with yet another surge that is really focused on folks who are not vaccinated, particularly young adults who are showing up in our hospitals and ending up in our acute care units and our ICU units. Here at Harborview, we have 2 people with COVID who are not vaccinated, who are on heart-lung bypass machines. And this has been an unfortunate constant over the last year and a half, just looking at the impact of this pandemic. So what is UW Medicine's response? Well, in concert with the University of Washington, sort of our parent organization, the decision was made fairly early on that we really wanted to support widespread vaccination. In fact, now have vaccination as a requirement across the University of Washington and UW Medicine. This is a topic of constant evolution and discussion about what this actually looks like. But as it stands right now, all healthcare workers within UW Medicine, so that includes staff, students, trainees, and faculty members like myself, are required to be vaccinated by the beginning of September. There are exceptions for folks who have medical reasons, which are actually far and few between, for folks who have religious reasons to decline. And right now we have a philosophical declination, again, that's aligned with the University of Washington process. The thing that we really recognized early on, as we looked at organizations like the University of Washington and healthcare systems across the country adopt mandates or requirements for vaccination, is that as when we think about, potentially being a patient or having a family member as a patient in a healthcare or organization, in a clinic, in a hospital, what I want to see if I was in that setting, if one of my loved ones was in that setting, is that every member of their healthcare team was fully vaccinated in order to protect, them from giving me COVID. I think there's a lot of focus on worrying about healthcare workers being exposed, and that's certainly an important role for vaccination in the community. But I really want to get everyone in the healthcare setting vaccinated in order to prevent transmission from patients to healthcare workers, from healthcare workers to patients, and really importantly, stopping transmissions between health workers, given how often they're working together and often socialize, which is completely normal and human out in the community. The thing I also want to mention is that in UW Medicine, we continue to require masking in all settings, as long as if you're within any distance or close to anyone else. And it's because we want to use sort of the belt and suspenders, or the seat belt plus the airbag plus the anti-locking brakes approach here. We want to get everyone vaccinated, as the largest number possible. And we want to have other tools in place to actually maximize the safety in all of our facilities. And so I really strongly believe and fully support WISH's approach to WSMA's approach to supporting required vaccination of healthcare workers for all these reasons. Thanks, Cassie.
Thank you so much, Dr. Lynch. Florence, how about you?
Good morning, everyone. Thanks, Cassie. I'm Florence Chen. I'm the Executive Vice President and COO for Multi-Care Health System. And thanks for the opportunity to share some of our perspective, as well as how the board, the Washington State Hospital Association Board of Director came to the decision. Before I talk about that, I think it's really important to talk about the whys. As the healthcare leaders, we believe there's no higher priority than the safety of our employees, patients, and the community we serve. It became even more critical as a result of pandemics. We have witnessed firsthand how devastating the effect of COVID can be. As Dr. Lynch described, was a couple cases in his organization, and the recent rising numbers of Delta variants as we all see that. And also, we also know the effectiveness of vaccine, that 99% of the COVID deaths are among non-vaccinated populations. And in addition, as healthcare professionals, I think that we have a more obligation to deliver the very best health system to our communities in the most cost-effective, least burdensome fashion possible. It is truly our responsibility to do so. I think that Cassie mentioned already the WISHA Board of Directors thought through this in many ways as we come forward with our recommendation going forward related to requirement for vaccination. And there are many factors we work through, we talk about it, deliberated, and think about how we can best move forward. We understand the vaccine acceptance by local communities different. We worry about the unseasonal high patient volumes. You heard us talk about this already. In any given time, we have extremely high number of patients in our ED waiting for beds, and so forth. We have unprecedented staffing shortage, extremely high vacancy in all our health systems. And talking about prolonged workforce fatigue and anxiety, and they've been tired, and also extremely concerned their own wellness, as well as the concern about vaccine being in emergency use authorization. So those are all the key points that we discuss as a board of directors. At the end of the day, I think that this become pretty clear to us the direction that we need to go. And on Monday, July 26th, the final decision was made and a recommendation going forward. And so that is why we're talking about the direction as the State of Washington Hospital Association. As we mentioned already, there are extremely high numbers going on right now, and the implementation, how we're going to go forward with implementation, it is also extremely important. I think the board was very intentional about the action that we need to take place to give each member hospital flexibility in implementation. For example, as a multi-care health system, we are in the process of communicating to all our employees and providers within our health system to go forward with making this as a condition of employment in our organization. And that is in process at this point. I think at the end of the day, every day a patient puts their trust and their lives in our hands. And it is truly our duty to protect them. As leaders in the community, we are standing by the information and messaging. We have a community to all of you, to the public. And we need to lead by example. And truly, I think that's the call that I think that we have in place, and we intend to do so to address the rising challenge that we have in front of us. So thanks for the opportunity to share this information with you, our perspective, and I'll turn it back to you, Cassie.
Thank you, Florence, and thank you for your leadership in this process. We really appreciate it. Dr. Slicker, we would love to hear from the Medical Association how you all are working through your stance on vaccine requirements as well.
Definitely, and thanks for putting this together, Cassie. I share with you the frustration and fatigue at having to be back here to talk about this again. As an ER doctor working on the front line of this pandemic for the last 18 months, I think we all had a hope that as we came off the numbers, in May and June, we might see a bottom, and I think we're all struggling to mount again the resolve to climb this hill once more, to go up against Delta as we see cases explode. In June, I would do shifts and not treat any COVID patients. On my last shift, I had 5, 2 of which are now in the ICU. Every day, this battle looks to be slipping backwards. And I think that is not only fatiguing in terms of the actual wear and tear on our staff, but spiritually fatiguing that, this is a preventable disease with vaccine, and we're seeing that slip out. And that's why the medical association, really came to the point where we said, we need a vaccine requirement. Patients should come to the hospital expecting that they don't leave sicker. They shouldn't have to worry, are they going to get COVID from us? And we also believe that it's important to protect our staff. We're now at a point where over 4 billion doses, B with 1 billion doses of vaccine have been administered in the world, and 346 million in the United States. When we think about testing and safety and efficacy, a lot of cancer drugs make it out onto the market with 1,000 or less patients in their safety profile. We're at billions of doses with great safety and even better efficacy. So any concern that this is not a safe and effective vaccine, I think we've now done arguably the largest study in human history to prove that it's safe. And because of that, we really believe that everybody who's working on the front lines of healthcare should be getting vaccinated to protect themselves, to protect their family. I've got 2 kids that can't get the vaccine because they're too young, and also to protect their patients. It's our obligation as those that work in healthcare. And so that's why the Washington State Medical Association has now come out and supported an expectation that all those in healthcare get vaccinated that can, except where there is a religious objection or where there is a medical condition that prevents it. If we don't do this, I really worry what this fall is going to look like. And much like you, Cassie, I reflect that I never stopped wearing my mask because this disease hasn't gone away. We're seeing it again. But more than that, I wear it because of all the other respiratory conditions. And that's what scares me when I look to the fall and to the winter, is that, last year, for the first time in my 20-year career, I didn't treat a single flu patient. And we tested everybody with the sniffles for COVID and the flu. To go an entire flu season without seeing a single patient. And now we're looking at a winter where if we're not masking, we're going to have flu and COVID and RSV, as well as everything else going on in our system when we are already at capacity, when we are already, as Florence said, having people waiting in our ERs to get that bed. That to me, is a hugely daunting task. So, if you don't wear the mask for COVID, wear the mask for flu, wear the mask for RSV, pick your reason, wear the mask. Let's try to have a little bit of space this winter left in our hospitals so we can do the important care. And that's not just the emergent care for those that walk through my ER door. It's also the elective and semi-elective and urgent care of heart bypasses, of cancer care, of all the things we know got put off last year as we struggled through our first wave of this. So I really hope that people hear today that, we've got the Medical Association, the Hospital Association, thought leaders throughout the state coming together saying it's time for all of us to roll up our sleeve, get the shot, do our part. Let's beat this back. Let's cap this, 5th spike now and try to, survive together this winter so that there's a healthcare system and people working in a healthcare system left to care for you. If you don't want to do it for yourself, do it for all those that are going in every day and putting their life on the line to take care of you. They'll appreciate it.
Thank you, Dr. Slicker. All right, I think we are ready for questions, and we do have one in the chat about referring to Dr. Lynch, your comment about the heart-lung bypass machines. That is ECMO. That was one of the questions. And then how many more of these machines do we have around the state? How many do you all have at Harborview?
I think at max we can do, I'm not 100%, I think it's either 4 or 5, it's called a circuit. And it's really important, just to sort of build on what Dr. Schlicker mentioned, is that every machine takes an expert nurse who knows how to run that machine, and respiratory therapists and critical care doctors 24 hours a day. Generally, they're such complicated scenarios that it's one nurse per patient on that machine. And when we look across Washington State, it's pretty limited. There's a few health systems with these machines. Harborview is one of them, UW-MC, Montlake, I believe Swedish. And it's much more limited than ventilators. And very quickly, we start looking at moving to Oregon, to basically to Portland. And Dr. Schlicker probably knows these numbers off his top of his head better than I do, but it is a very limited resource. And we've been running at higher ECMO numbers for the last, 18 months, at numbers that a year and a half before we would never see 4 or 5 people on ECMO at a time.
Thank you. The second part of this question is the availability of ventilators, which I think we are actually well stocked in ventilators. They are not used as much or as quickly in COVID patients, and the state also purchased quite a number of ventilators, which we were very grateful for, and was able to distribute those to hospitals that needed them. So that's not one at the moment that we're worried about. The third part was, do we risk getting overwhelmed? Yes, we do risk getting overwhelmed in our hospitals right now. And that's why we're here pleading with the public to take all the actions possible to not get COVID and then do other things to make sure that they're taking care of themselves, like see their primary care physician and a specialist, and don't fall off your ladder.
Can I just say something really quickly, Cassie? Yeah. One of the things I've learned over the last year and a half, I'm an infectious disease doctor. My focus is infection prevention and control, employee health, and similar. But I've really learned from Cassie and many other health leaders across the state in the last year and a half is that our health system's built for a certain number of people that we expect to come through who need elective care, who need emergency care, who need clinical care, in the ambulatory setting. And COVID really pushed us all well beyond that. And we are kind of at that threshold. We don't have extra nurses, extra doctors, extra respiratory therapists sort of ready to go who are doing nothing. They're all working extremely hard. And when it comes to an ECMO machine, as I mentioned, but also someone who needs a ventilator, that's an ICU patient who needs an ICU doctor around the clock, needs an ICU nurse around the clock, needs a respiratory therapist around the clock, and needs a space, literally a bed to put that person. And I really worry where we are in Washington State, and this is similar to colleagues across the country, is that we are pretty much at max with the number of beds being occupied and the number of people who are staffing that across the entire spectrum of specialties in medicine. Again, if we don't get people fully vaccinated across the state, we're going to run into way more trouble. And there are counties in our state where we're looking at positive test rates of around 20%. 1 out of every 5 people getting tested in some counties in the state are positive for COVID. And these are unvaccinated people, right? And so we really, as again, going to what Nathan said and Florence and Cassie, we need people to get vaccinated because this is the most powerful tool we have. And in the midst of all this, those of us who are vaccinated, making sure we're fully, wearing our masks and following all the other things that we needed to keep safe. Sorry, over.
Thank you. I think another thing that has happened that to me got very little public attention, but is interesting, is that many insurers early in COVID said there would be no co-pays, no co-insurance, no cost sharing for COVID care because it was, you couldn't prevent it and it was such an overwhelming disease. Many of them have changed that policy now, just recently, because it's a preventable disease now. And so for folks who are getting this incredibly intensive care, the financial strain could be significant as well. A question from Nick about how the status of our children's hospitals are doing right now, and noting that the children's hospitals are, actually we have every hospital in the state, military, veterans, children's, psychiatric, small, rural, large system, they all belong to the associations. The children's hospitals do. Their children's hospitals are getting full with more COVID patients. That was from Louisiana. And there is that concern here. We have 3 children's hospitals. One is Seattle Children's, one is Mary Bridge in Tacoma, and the third is Sacred Heart in Spokane. And I'm going to turn over to Florence in just a second, but I will note one thing that we heard from Seattle Children's, which is last year, because children were largely unaffected, Seattle Children's had offered to take patients up to age 21 or 22. I think Mary Bridge, I believe, was doing the same, kind of exceeding their normal age range to take some of the pressure off the adult hospitals. And they are not able to do that any longer. So Florence, maybe you could comment on what you're seeing in Mary Bridge right now.
Yes, at Mary Bridge right now, because the surge that we have in the amount of adult hospitals, we are taking exception. We're taking additional patients up to age 21 in our hospital. to care for them. I think what we are seeing in the children's hospital right now, and is as I said, as it is we probably see more behavioral health challenge to the patients than anywhere else. Yeah.
Thank you. Another question about how many hospitals or what percentage of member hospitals are going to require vaccines. I don't think we know that yet. The board, the Washington State Hospital Association Board of Directors took this action last Monday. So we informed our hospitals about it, our member hospitals, urging them to take action. And as many of them are working on it right now. I think it will be a majority for sure, but I don't know yet how many. And some have already announced that they're moving this way. And others, I think, are in the process this week and next of doing so. Is staffing or fear of losing staff a reason we're hearing for why hospitals might not require vaccines? Yes, that is a concern. I think that staffing is tight, and that is a concern for sure. Dr. Lynch was actually a guest speaker at our board meeting to discuss this, and I'll say what you said, and you can remind you what you said, and you please feel free to jump in if you want to say more about it. But he made a comment that was very compelling in response to that. Was you might be concerned about short staffing because of the vaccine requirement. If you don't have your staff get vaccinated, they're going to get COVID, and they're going to expose their coworkers, and they're going to be out. You're going to have a much more acute staffing crisis. So I think that was I think an insight that really moved our board. Dr. Lynch, any more you want to say about that?
I think you said it very well, Cassie. I think the issue is that, especially for unvaccinated health workers, and it's true for unvaccinated any community members, this Delta variant is so transmissible, so infectious, that if you are not vaccinated, if you don't take all those measures, masking and distancing and vaccination, this is going to sound quite morbid, but you will get COVID. This will find you, especially if you're in any type of setting where there's other people who are unvaccinated. And so, yeah, everyone's concerned about requiring vaccination. Not everyone. Some people are concerned about the requirement for vaccination and impact on staff who choose to not get vaccinated and potentially lose their positions. But that will happen if you have unvaccinated health workers. They will get exposed or infected, and then you're going to be dealing with much larger staff loss, to be honest. And that's across the board. It's the ER doctor, it's the ICU doctor, it's the nurse who's running that ECMO machine, it's physical therapists, it's a front desk staff. And the impact on a short-staffed, overburdened health system, you can imagine how troublesome that could be.
Well, Florence, I think the narratives need to shift, because I do think that the impact is even more significant, right? Think about when you have a COVID positive employees, and you need to quarantine the rest of the people that they touch and they get in contact with. So it's more than just one individual that need to be out of workforce, but it's a lot more than that. That's one aspect. The other aspect is that we do care for children, and those are children that come into our hospital, they are not able to get vaccine, and it will create significant risk to those population as well. So I think for those are the key reason, it is truly even more important why the requirement is crucial at this point for all hospital workers.
Definitely. I think we have some good data out of some of the health systems that went in the Southwest and South before us, that the actual departure rate was around 1%. So it was not the feared 30% or anything like that. So I think we have some good data there. And I would add to it that it's not just the people, it's the places. When we've had outbreaks in various institutions, taking down a whole floor of a hospital has a huge impact on the community for elective and emergent care. So as Dr. Lynch said, one or two positive staff members could have huge reaching implications beyond just their two positive cases if you have to shut down 30 beds and quarantine 40 staff members. So it's a short-term pain for a long-term gain, hopefully at worst. But I really hope that the science speaks for itself here. I think we keep talking about those that are going to choose to leave, but I think the science should speak for itself. One of the most tested, largest ever safety profiles and most effective vaccines we've created should be enough that if we're practicing and selling science in the health system, we should be taking our own medicine, literally and figuratively here.
Thank you. We got another question that I'm going to send to Dr. Lynch, saying, Charlie is tweeting about this, and someone posted a screen grab from the King County dashboard. Is their claim that only 2 people are hospitalized with COVID in King County accurate?
We have one of the best public health organizations here in King County that I know about in the country. So Public Health South King County, with Health Officer Dr. Jeff Duchin, who is responsible for these data. I trust them implicitly. I work with them constantly. They don't have data for 8 o'clock this morning, but the data that they have and are reporting are, rigorously reviewed, and I trust them very much. I've used their data and trust their people and have for a long, long time. So I'll try to look at that while we're talking here, Cassie.
Okay. How many patients do you all have in the UW medicine system right now that are COVID positive?
Yeah, I'm just running it now. So we were below 10 just a few weeks ago, and I think we are, as this morning, 15, we're in the mid-20s, which is unfortunate. And because of the way, the role that Montlake, UW-MC Montlake, and Harborview have specifically, we have a disproportionate number of ICU patients because people get moved in, and this is true for Florence and Nathan. In their systems, you come from a smaller hospital, people get very sick and they get moved to a larger hospital that has more ICU capability. And that's what we're seeing. And that's partly why we have, a couple people on ECMO here at Harborview, because that's who people send to us to get that care.
And Dr. Schlicker, can you tell, you were saying before we started the number of patients that you have and how when you were at your lowest and now where you are now?
Yeah, in our system, we were down into the high 20s, and now we're up into the high 60s in the course of just 2.5 weeks. And some of that in King County as well. So I think the 2 is a little bit low, but we're definitely seeing it explode up over the course of the last 2 weeks. And like I said, we hit that bottom right around the mid to high 20s, and now we're flying back up into the high 60s. And the line is pretty steep. It doesn't look like it's going down anytime soon.
So I think the answer is that the data that's being tweeted is not currently accurate. It might have been accurate a few weeks ago when we were at a low point. So it's possible. I don't know this for sure. It's possible that it's old data.
I can share multi-care's data.
Sure.
And Friday evening, at the end of the day, Friday, we have 103 patients across all hospitals. And that number actually increased by 50% from a couple of weeks ago.
Thanks, Florence. Okay, for Dr. Lynch, is there a higher risk of breakthrough infections with Delta versus the other variants before it, or is it too early to say?
Yeah, it's a little early to say. We've obviously seen a lot of data from the CDC in the last week or so. There's a MMWR report that's freely available on an outbreak in Provincetown just recently that sort of underlied a lot of the recommendations. What we know is that there was a certain level of protection afforded by the vaccines based on when they did the studies, when there was the wild type and then some of the alpha variant and some of the other variants concerned, where we saw very high levels of both efficacy and effectiveness, so real world utility in the high 90s. And I think with Delta, what we're seeing is that rate of breakthrough is a little bit higher with Delta, and that probably has to do with just being a lot of virus, but also remember, a lot of mixing, right? Our community is different in the way we're acting in society with and without masks, with and without vaccination, than it was back when these vaccines were studied. So it's probably a combination of things. But probably I just want to emphasize this a lot. So if you are vaccinated and you're looking at Delta, your risk of infection remains 3.5 times lower, right? These are extremely effective. As Cassie mentioned, 99% of the people in the hospital who have COVID-19 are not vaccinated. So your risk of getting COVID, getting ill from COVID, right? Symptomatic, sick, ending up in the hospital is about 8-fold lower. And the risk of dying or being seriously ill in the hospital is about 25-fold lower as it stands right now, even with Delta. So even in that big outbreak, a lot of the folks who were infected were very minimally symptomatic. And that number was a very small number compared to the overall denominator. And I think that's a thing that's really challenged a lot of these public health messages, is that they're talking about a number, 340 breakthrough cases, but they aren't necessarily being great about reporting the denominator. 340 cases over 60,000 people, for instance, in Provincetown, which is around, I think, 5.005 in terms of a ratio. So the vaccines are working. They're working in even these outbreak scenarios, and the people who are getting breakthrough infections or are vaccinated are not getting sick with them, and definitely not ending up in the hospital.
Is there any sense, do we have any information about the possibility of long COVID for people who have a breakthrough case?
So I think that's, again, still very early. I think that people, who get mildly symptomatic COVID, some proportion of them are probably going to have symptoms consistent with long COVID, but we're still very early in this. I think it's a really important question because when we think about the impact of COVID, for folks who are perhaps arguing against requirements on vaccination, they're pointing to death rates being low. So our death rate due to COVID is 70% less now than it was a year ago, which is fantastic. But we don't only want to look at people who die from COVID. We want to look at people who end up in the ICU, people who end up in acute care, people who end up in the emergency department, people who end up in clinics, and people who develop long COVID. We've had Dr. Helen Chu and her group here at the University of Washington demonstrate about a third of people with symptomatic COVID have symptoms that persist. And we don't even know how long those are going to last. And we're probably some small portion of people who are vaccinated who do get symptomatic COVID will have symptoms consistent with that. And just going back to, Nathan's point, I don't want to see this happen in anyone, but imagine this happening in a kid, right, who can't get vaccinated yet, or someone who's immunocompromised, right? That's really a failure of all of us who have the choice and allow that to happen.
Thank you. A question about the changes that insurers are now treating this. So I'm going to actually put an article in the chat about this from Kaiser Health News. These are new policies. I think it'd be worth checking with the insurers to see what their current policies are, but a number of them have actually fairly quiet. I think it's been, it's across the country and it hasn't been very well covered, but testing and vaccines, I think, remain free to the patient, but it's the treatment if you get COVID. And a lot of the treatment, people are in the hospital for a really long time, is high level of staff who are taking care of them, high level of equipment, high level of medication. All those things are expensive. And so if you have a insurance plan that requires a 10 or 20% or something cost share, it could be sizable. So I can't tell you specifically which insurers are doing it and how. It's just something that I know is changing right now that would be worth knowing more about. I don't know if anyone has any comment on that. Okay, great. Do we have an estimate on the percentage of healthcare workers who are currently vaccinated against COVID? Is it higher than what the state is reporting for the population as a whole? I believe it is higher than what the state's reporting for the population as a whole. Maybe each of you could share your vaccination numbers. It does vary across the state for sure, but could each of you say how many of your staff are vaccinated?
Nathan, you want to go first?
I was just going to say, based upon an AMA study, 96% of physicians are vaccinated. So I think everybody's led with their arms. Personally, I actually don't know a physician that hasn't gotten vaccinated. I knew one or two that practiced in the Southwest that held off until February, March-ish due to some personal reasons. But otherwise, everybody I know that's a physician, including pregnant physicians, have all gotten vaccinated. So in the physician community, it's 96%. I think we've led with our arm as we said we would from day one.
From multi-care, we are at about 70% folks being vaccinated.
In UW Medicine, for overall, we're approaching 90% of all healthcare workers are vaccinated. The physician group, the faculty group is, it's a little bit higher than 96%. So we're doing really well there. And I'll just mention, I think it's about 100% of infectious disease doctors are vaccinated and continue to wear masks. Definitely trying to lead the way there.
What we have heard from our members is that those staff who have cared for COVID patients, whether infectious disease, critical care, but the physicians, the nurses, the techs, the folks who are delivering meals to those group, because they have witnessed the sickness and how the sickness, the grief, the anguish, the long-term effects of COVID, their vaccination rates among those groups are exceptionally high. And we've heard a number of them say they wish everyone could spend a day in their shoes because they would get the vaccine as fast as they could. But there is, also to your question, there is definitely variation. And there's some parts of the state, especially in some smaller rural communities, where the vaccine rates are lower than what you just heard. Any other questions? All right, well, our dream would be that we don't have to do this again, because we squelched this possible 5th wave and then everyone gets vaccinated and we don't have to talk. There's no COVID news to report. I think that's probably not the case. So we probably will be back with you in a couple, 2 or 3 weeks with whatever the newest news is. We are always available to take your questions outside of the cycle as well. So thanks so much for reporting on this. Really hope that you will be encouraging to the public to do everything they can to protect themselves. This is a terrible disease, as Dr. Lynch described. The viral load from Delta is really high. We are very concerned about how sick people are getting, including younger people. And it's just, we want people to protect themselves. So I hope that they will do so. Thanks very much. Take care. Bye.
Thanks all.